My name is Katie Owens. I am the co-founder and president of the Healthcare Experience Foundation. On behalf of our entire team, I am so excited to welcome you to our conversation today, where we're going to be really focusing on the Healthcare Experience Academy and giving you a preview of all of the extraordinary learning resources available. We focus at Healthcare Experience Foundation on our academy equipping leaders, staff, and physicians with skills and competencies to deliver excellent care every patient, every time. At the Healthcare Experience Foundation, our core belief is that every person is worthy of an environment where they can both deliver and receive the best healthcare experience. And the Academy is our online learning and training platform to support that effort. I mentioned my name is Katie Owens. I'm our president and co-founder and get to work with our extraordinary team of physician leaders and coaches, nursing and clinician leaders and coaches, learning and organizational design. Our team is based across the entire country, and the body of knowledge created in the Academy is based on our collective experience with over 600 healthcare organizations and navigating the workforce engagement, quality of care, and patient experience of care demands, and creating those consumable learning experiences. My hope today is that we can cover 3 objectives. First, introduce the Healthcare Experience Academy. Next, share some key outcomes expected, and then demonstrate our approach to development. And I've picked a service recovery video for that. At the end of the day, our goal is to inspire and activate your people, your organization's most important and valuable resource. So I would offer up some questions for your consideration as we talk about the opportunities before us for patient experience education. Think about and reflect what's working well with your current training initiatives. What do you see as missing? And what outcomes are you looking for most to support healthcare experience training? Is it you're looking to move the dial with quality and safety? Are you looking for a tool to equip your leaders and your physician leaders to better retain physicians, clinicians, and staff? Are you looking to jumpstart or regain momentum with patient experience? Or are you looking for tools for physician and advanced practice provider engagement? And the last and certainly not least question is what objective, let me find my words here, success would you like to see in the next 12 months? Those questions are really important and formative to how we support organizations implement the Healthcare Experience Academy, because we're constantly looking as a team how to close gaps, how to help you build momentum, and how to reach the team members who most need development to support key outcomes. And so our Healthcare Experience Academy, we have a growing library of courses that range from compassionate communication, managing and navigating conflict, empathy, emotional intelligence, service recovery. We have toolkits for HCAPS, the Primary Care First Survey, medical practice excellence. We also have patient rounding, burnout and resiliency resources, and then 15 quick tips. And then coming soon, we have our diversity, equity, and inclusion course, reward and recognition, measurement and accountability, and hourly rounding and bedside shift report. Every every course is made up of micro-learning videos that also include a specific learning guide and resource to help leaders, staff, physicians, and clinicians activate what they're seeing in the video and how can they apply that learning. So let me show you our service recovery video. So our service recovery course covers a number of lessons from becoming confident with service recovery, cueing into service failures, uncovering the unsaid, because many times patients are not always comfortable voicing their concerns, communication and conversational tools to respond when service failures occur, and tools to navigate the service recovery conversation. So let's play the first video.
to research, 55% of individuals are worried something might go wrong during their hospital stay. We can all relate to times we've been disappointed by service, restaurant, travel, or product experience. Chances are there are instances when that individual or organization stepped in to recover your disappointment, as well as times when no one addressed your concern. How did their action or inaction influence your loyalty to that organization? The reality in healthcare is that recovering disappointments is profound to shaping the memories, referrals, loyalty, quality, and service outcomes. Industry standards and our own experience tell us that when we turn service failures around for our patients and their loved ones, we improve all of these outcomes. We're a high-risk, high-emotion industry, and despite our best intentions, we can make mistakes. Knowing we must work harder and harder to meet the demands of patients and consumers across our diverse care settings, evaluating the effectiveness of your service recovery process can pay dividends in creating patient and family loyalty. Service recovery is a communication practice and process that should be used to make things right after something has gone wrong with the healthcare experience. Service recovery activates the instant we learn we have not met the patient or their loved one's expectations. When does service recovery matter most? When a patient or loved one is upset. When there's a failure to follow up on a request. When a dietary order is wrong or something is missing. When there is inappropriate or rude behavior from staff. When belongings are lost or misplaced. When a patient experiences long waits without updates being provided. Or in any situation that embarrasses, inconveniences, angers, or disappoints a patient or their loved ones. One tip is to brainstorm the typical types of service failures or disappointments that happen in your unit, department, or organization. You can then create a formal tracking for service recovery with a standard set of responses that match the circumstance. This will help staff become more confident responding in the moment. Here's some questions to help you get started. To ask of yourself and your team. When was a time that service recovery was effective? What made it effective? When was a time service recovery was ineffective or we missed the mark? What went wrong? When do you feel confident identifying and responding to a service disappointment? When do you feel not as confident responding to a service disappointment? Service recovery matters. These points will help you begin the conversation with your team and boost confidence responding when it matters most.
So as you can see with service recovery, with this first lesson, we're really trying to help set the expectation, define service recovery, and begin the change management process. And so, as I mentioned, every Healthcare Experience Academy course and micro lesson has this toolkit for leaders to then facilitate with their staff, clinicians, and physicians application of learning. We're also often asked, what are the key results we should expect from the Healthcare Experience Academy? The first is we want to see improvements in patient outcomes. We want to see advanced results with your patient experience surveys, improved team engagement, growth in physician loyalty, leader, staff, and physician retention, and improved quality and safety outcomes. The next key result is that we want to see real-time development. We want to reduce variability. We know that the last few years has caused a stress and strain on staff retention. We have a lot of new graduates, a lot of less tenured team members, and a lot of new leaders. We want to reduce variability by equipping everyone with a core set of evidence-based practices. The next opportunity is to streamline onboarding. We want to fast track onboarding. We want to help equip your team members beyond your hospital, clinic, or organizational onboarding session to more proactive tools and resources to advance patient experience and quality of care. We want to cultivate those necessary skills, especially the ones that go beyond the task, the clinical or the procedural requirements of the job. And we also want to introduce process sustainability. We know for every live training, in just a short amount of time, depending on your annual turnover rate, a lot of new team members are joining the organization. And last and certainly not least, because we know the importance of financial stewardship, we want to reduce your cost structure. We want to provide you with affordable training for everyone. We want to reduce inefficiencies. We want to reduce the burden of your internal training and labor. We also, have talked a lot about over many years at the Healthcare Experience Academy. We have learned during the pandemic and the ongoing stresses and strains that equipping our workforce is more important now than ever before to reduce that variability. And so every one of our lessons and courses is written and taught by healthcare leaders, designed to be scalable for large or small organizations. And hopefully you'll find flexible and dynamic for teams. And so the interface is designed for on-demand learning. We have done a lot of testing with leaders, staff, physicians, and clinicians, and we wanted to create these digestible learning bites in an all-accessible environment to grow competencies and access to education. We can also offer implementation support in addition to clients who just want to self-manage. We can support you with generating momentum at launch, provide you with a sample improvement roadmap based on your outcomes, which courses can have a sequential impact. We can hold quarterly leadership discussion groups, coach certification, and client service support. And I love to close with some sample use cases. We saw an organization really effectively deploy enhanced leader and staff comfort with service recovery, streamlined development for patient experience competencies. Prior to the academy, this organization really relied on leaders to just do their best. And this provided a shared sense of resource for all leaders. And it has also been a tool to relaunch and refocus on patient rounding and rebuilding relationships for all leaders. And so we're thrilled and honored to partner with Blackburst Entertainment, and our online education and learning director, Walter Lowe, really said this so beautifully. We want to activate the workforce by blending the latest learning principles with accompanying visuals designed to accommodate a variety of learning styles. And we're focusing on the topics we're hearing most from you, the healthcare community, including empathy, patient-centered communication, better managing the discomfort with conflict, service recovery, and more. And we're really excited about our upcoming work around bedside behaviors and restoring that focus, and a project that is of deep passion to all of us at Healthcare Experience Foundation around diversity, equity, and inclusion. And love including some comments from key stakeholders, from Samara and Craig, how to help provide healthcare leaders, staff, physicians, and clinicians with real-time learning to support the daily challenges that we experience. And from Mark Ruley at the Maryland Healthcare Education Institute, how do we build resources accessible to leaders in their improvement toolbox? Thank you so much for joining us today